Tooth pain keeping you awake? That infected tooth needs immediate attention. Let's reveal what happens during a root canal treatment in 3D.
Decay reaches your tooth's nerve. Bacteria invade the pulp chamber, causing severe infection and unbearable pain. Your dentist uses X-rays to see the extent of infection and plan the precise treatment approach. First, local anesthesia is administered to ensure you feel no pain during the entire procedure. A small access hole is carefully drilled through the crown to reach the infected pulp chamber. Specialized instruments remove all infected pulp tissue and bacteria from inside your tooth. Each root canal is meticulously cleaned and shaped to remove all traces of infection. Antibacterial solutions disinfect the canals, ensuring complete elimination of harmful bacteria. The cleaned canals are filled with biocompatible material called gutta percha to seal them permanently. A temporary filling seals the access hole while your tooth heals and prepares for the final restoration. Your tooth begins healing immediately. The infection clears and surrounding tissues return to normal. After healing, the tooth is prepared for a permanent crown to restore its full strength and function.
A custom-made crown is placed over your treated tooth, restoring its natural appearance and strength.
Your root canal treatment is complete. The tooth is now healthy, pain-free, and fully functional. Don't let tooth pain control your life. Root canal treatment saves your natural tooth. Consult your dentist today.